Assalamu alaikum wa rahmatullah. Kull aam wa antum bikhair. Today's paper is the prevalence, predictive factors, and clinical course of persistent pain associated with teeth displaying periapical healing following non-surgical root canal treatment, a prospective study by Philpott et al. From Eastman Dental Hospital in UK. It was published in the International Endodontic Journal in 2019. Persistent pain after root canal treatment is usually considered to be due to persistent periapical disease. However, such symptoms, in the absence of clinical or radiographic evidence of persistent periapical disease, may be indicative of other causes. Part of the key to resolving this diagnostic dilemma is to exclude the presence of persistent periapical disease with greater certainty. This requires the use of imaging techniques with better sensitivity such as CBCT. The threefold aims of this study were to investigate the prevalence, pain catastrophizing, and other predictive factors and clinical course of persistent pain or discomfort associated with teeth exhibiting evidence of periapical healing following non-surgical root canal treatment. For the methodology, 264 patients who had primary or secondary treatment of a permanent tooth were given a catastrophizing scale and short form of McGill pain questionnaire and a visual analog scale were completed at first follow-up appointment between 6 and 12 months following root canal treatment. 25% of teeth displaying complete or incomplete periapical healing, which was 62 teeth, were associated with either pain or discomfort and were reviewed 7 months later. Then were further monitored at 4 and 10 years after treatment. The second review assessed 55 teeth in 48 patients who had shown signs of periapical healing with persistent symptoms at the first review. Of the 25 teeth associated with signs of periapical healing plus discomfort were reviewed further, the discomfort had decreased in intensity or disappeared in 80% of the patients, but had become worse or painful in 12%. Of the 10 periapical healed teeth in 10 patients with persistent symptoms, either pain or discomfort at the second review, 8 were subjected to CBCT scans and showed no apical pathosis associated with 3 teeth, small apical radiolucency associated with 2 teeth, and root apices fenestration at the buccal cortical plate in 3 teeth. 9 of these patients contacted 10 years later. 7 patients reported freedom of any symptoms. 1 patient had different sensation and 1 with persistent discomfort. The pain catastrophizing scale score revealed only 16 patients to be catastrophizers. It was found that history of chronic non-odontogenic pain such as headache, temporomandibular pain, neck, shoulder, or back pain found to be associated with persistent tooth symptoms and was 3.5-fold higher than those without such history. Teeth with preoperative pain more than 3 months had almost 3 times higher odds of persistent symptoms. With each millimeter increase in diameter of preoperative radiolucency, the odds of persistent symptoms were reduced by 13%, and the presence of crack only retained its predictive value at the 10% level. In conclusion, persistent pain or discomfort associated with teeth showing periapical healing at first review after non-surgical root canal treatment decreased in intensity in most cases over the following 6 months. Long-term follow-up revealed spontaneous improvement or resolution of symptoms in the majority of those with confirmed absence of periapical disease. 5 predictive factors such as history of chronic pain, teeth responsive to pulp test, teeth associated with preoperative pain, tooth crack prior to treatment, and diameter of preoperative radiolucency were identified.